All right. Think we got a lot of people logged on now. So thanks for joining us today, our first seminar in our spring 2025 series. We're very excited to continue offering these seminars over the course of the semester and sharing with our community the exciting work being done in the name of public health here on UT campus. Today, we have two researchers we're very excited to hear from. The first is Ashley LeMaistre. And Ashley is a senior outreach program coordinator for the Tobacco Research and Evaluation Team. She works with healthcare systems across Texas to help integrate the electronic tobacco cessation referral tool, e-tobacco protocol, into electronic medical records, electronic health records, and connects them with the Texas Quitline. She also works on the Texas College Tobacco Initiative, working with community and junior colleges and trade schools to incorporate Peers Against Tobacco programming on their campus. Ashley received her MPH from Texas A&M, where she also worked on the Texas Youth Tobacco Awareness Program. She has extensive experience in tobacco policy work and chronic disease media campaigns at the local level. She has a passion for reaching populations experiencing a greater burden of tobacco. Please welcome Ashley LeMaitre.
Hi, good morning. I'm really excited to be here, so thanks for letting me speak to y'all today. I'm going to be talking about tobacco cessation referrals and the Texas Quitline and e-tobacco protocol. So I'll first start talking about the Texas Tobacco Quitline and the resources available through that. And then I'll talk about why this work is so important and why we continue to work on our project so hard, and give you an overview of the e-tobacco protocol project, walk you through some of the challenges we've experienced, and then talk about some areas of opportunity. So the Texas Tobacco Quitline is a free service. It's funded through the Department of State Health Services, and it's offered in both English and Spanish, as well as additional languages through simultaneous interpretation. And calls are answered, and counseling is available 24/7, so it's super convenient. It's private, it's confidential, and it's also HIPAA compliant. The Quitline has some wonderful benefits, including between 5 and 7 counseling sessions for individuals who are at least 13 or older, and 8 weeks of free nicotine replacement therapy for those that are at least 18 or older. So it can be gum, patches, lozenges. They can do combination therapy, and it's mailed directly to the patient's home, which is also super nice. And referrals can be made at any time, and individuals can enroll up to 2 times per year. Just a few qualifications that the Quitline has. They need to have a Texas address so that the nicotine replacement therapy can be mailed. They need to have a U.S. phone number so those counseling sessions can be set up. And then, like I mentioned, they need to be at least 13 or older for counseling, 18 or older for nicotine replacement therapy, and they need to be ready to quit within the next 30 days. One of my favorite things about this program is that the once the individual has decided that they want to quit, and that referral has been sent, the quit line will proactively reach out to the patient. So there's no, the individual doesn't have to worry about then later making a phone call to the quit line. The quit line does all that outreach to set up that first appointment. So once that referral has been sent, the Quitline will call within 48 hours, and they'll make up to 5 attempts to reach that individual. They'll ask them several questions to just help tailor the program to their needs, and then they'll be paired with a trained quit coach. And then they'll have those counseling sessions and receive that nicotine replacement therapy depending on their age. On the healthcare side, those that are using sending referrals through their electronic medical record using direct messaging, they're able to get progress notes back. So there's that bidirectional feedback from the quit line. So the healthcare system will know if the individual enrolled in the program or didn't, if they started their counseling, if they received nicotine replacement therapy. So it just gives them the healthcare system a better picture of where that individual is in their quit journey. And then we also get an aggregate quitline report on a monthly basis. It's organized by clinic, and we can see how many referrals are coming in. And of those referrals, how many are actually enrolling or not enrolling in the program. And so that's something that is also sent out to healthcare systems to help them. There are several participant tracks that the Quitline has. So there's the general 18 plus track. That's the things that I was mentioning before, there's the 8 weeks of nicotine replacement therapy, including screening and dosing, 5 quick coaching sessions, and then continued access to call for additional support as needed. So if someone's getting a craving in the middle of the night, they can call a Quitline and receive that extra support outside of those additional formalized coaching sessions. If someone identifies that they're pregnant or postpartum, which is up to 1 year post-birth, or people who report mental health or substance use conditions, they receive everything that the general 18 plus track receives, plus an additional 2 coaching sessions. So that's a total of 7. And then they also receive tailored messaging relevant to their track. And then if someone reports that they're using menthol products, they receive everything that the general 18 plus track receives, plus tailored messaging. And if the people in the menthol track also identify as pregnant, postpartum, or have behavioral health conditions, they also qualify for those 2 additional sessions. And then for our 13 to 17-year-olds, they're in the youth digital track, so it's more engaging and interactive for that age group. There's quizzes and videos and chats and all sorts of things to keep them engaged. And while the Quitline covers all forms of tobacco, including vaping, if someone is interested in just a different program specifically for vaping, there's the standalone Live Vape Free program. So individuals can enroll in that by visiting the Live Vape Free website or texting Vape Free to that number. There are a few different ways that individuals can be enrolled or referred to the Quitline. So there's a paper-based fax referral, and that form is found on the yesquit.org website. There's also the e-tobacco protocol, which I will talk more in depth about momentarily, done through the electronic medical or electronic health record. And there's also an app referral that can be done through the Texas Quitline app, and I'll talk more about that later as well. So why are we doing this project? Why are we focusing our work? According to the 2020 Surgeon General's report, among current adult smokers, nearly 70% of them want to quit, and over 50% of adults who are smoking will try to quit each year. And then 3 in 5 adults who ever smoked have already quit. And when a healthcare provider is actively intervening to connect their patients with cessation resources, patients are 66% more likely to be successful in their quitting tobacco. And we know that brief cessation interventions are not only clinically effective, but they're also cost effective. We also know that some form of behavioral counseling, when it's combined with cessation medication, can double a patient's chance of quitting and being able to stay quit when compared with someone who's using self-help or no treatment at all. In fact, fewer than 5% of people who try quitting without any assistance are successful in quitting for more than a year. But unfortunately, many healthcare systems are not consistently collecting data or referring to the Quitline, and more than 40% of smokers in healthcare settings are not receiving tobacco cessation counseling. So the e-tobacco protocol was developed based on recommendations by the American Academy of Family Physicians, and it's a one-click process to connect patients to tobacco cessation in healthcare settings. And I'll be going more into that shortly. But the pilot for this project began in 2011 with just 3 healthcare systems. So there were 2 systems that were larger, so they had 20 or more providers, and the other was smaller, so it just had 3. And there was 1 staff member that was identified as being the lead for training. So they received training on the Ask, Advise, Refer protocol and the e-tobacco protocol. And they then trained the rest of their staff. So to ultimately get through a cessation referral, healthcare providers are advised to use the Ask, Advise, Refer workflow, which is an evidence-based approach to tobacco cessation. It's a pretty quick process. It takes between 3 and 5 minutes, depending on if the individual is identified as a tobacco user. So you would start by asking the individual about their tobacco use, which includes all forms of tobacco, including vaping. And if the individual is a tobacco user, you would then provide some brief intervention to advise them to quit. And then finally referring them to cessation, in this case, the quit line. So I can mention this before, the e-tobacco protocol is a one-click connection to be able to send a tobacco cessation referral directly from the healthcare system over to the Texas Quitline within their electronic health record. So it's super convenient. They're already using their electronic health or medical record, and this one click and they're able to send that referral and get their patients that help. So it's really an efficient counseling and referral option. I mentioned before, there's that bidirectional transmission. So the healthcare system is getting feedback from the Quitline on um, the individual's progress in the program, system-wide public health impact, and potential revenue if they meet the tobacco cessation quality control measures, and it's HIPAA compliant. So there were three specific evaluation questions that were posed in this pilot study. Was the program implemented with fidelity? Did the integration of the protocol increase the number of referrals to the Quitline? And what barriers existed in integrating the protocol into a healthcare system's workflow? So there were two focus groups. The first was done following the training that was received by the healthcare systems, and then the second was conducted 6 weeks after the pilot. There were a total of 52 participants from these healthcare systems, all focused on health, um, and they were used to help answer the fidelity and barrier questions. And then Quitline data were used to answer the impact on the Quitline referrals by providers. So in terms of fidelity, the focus group data indicated that it was implemented with fidelity. So once it was integrated, it does function as a one-click referral process, and the protocol reduces intake time, and it also incorporated a more strategic and planned approach for tobacco cessation referrals. And then in terms of referrals, the project looked at compared the use of paper-based or fax referrals, which at the time was the only way to make a referral to the Quitline. And baseline data from the year prior to the pilot indicated that there were only 7 referrals that were made. And then during the pilot testing year, of the more than 80% that were screened, about 11% were identified as tobacco users. And then of those, 4.4% were ready to quit. And of those patients who were ready to quit, there was a referral rate of 88.4%. So that's 1,254 referrals to the Quitline services. So this is obviously a dramatic increase from the previous year. And then some of the barriers that were mentioned were mostly related to technical issues within the clinic. So, making workflow adjustments, overall staff capacity, turnover rate, things like that. So through the evolution of this project, there was a gap that was identified that there were individuals who were working within the community who did not have access to the electronic medical record, but they were in a capacity to be able to make referrals. So our UT team developed the Texas Quitline app. This is used as a tool to make referrals without the need of the electronic medical record. So it's free on both Android and Apple platforms. So I did just learn that they're working on, technology is always changing, and Android is on a little bit of a hold if you're using operating system 15 or higher, but that should be out in a couple weeks. Doesn't impact those that already have the app. Just wanted to plug that in case you go search for this. So it is free though on both platforms. It's perfect for community health workers. In fact, we use community health workers to help develop this, and as well as mobile staff who may work out in the field and don't necessarily have access out in the field to the electronic medical record. Also a nice alternative if for some reason the healthcare system isn't able to integrate the tobacco protocol. And it's also HIPAA compliant. So again, just to clarify, this is a tool that is meant for to be a tool for providers, nurses, community health workers, care team who are trying to make the referral. So this isn't an app for those that are actually trying to quit. Um, Wanted to share some of our results from this most recent fiscal year. So we do a lot of outreach to healthcare systems. In this past fiscal year, we were able to outreach to 85 healthcare systems, and we had 8 healthcare systems who were either a new integration, being reintegrated, or made it to the testing phase. So you can see to the right, there's this map to just kind of show you where all of our clinics are that are currently integrated. We did 23 trainings and we were able to train 334 individuals. This includes healthcare professionals as well as community health workers. And I wanted to summarize we have a lot of technical assistance that we're able to provide for free through our grant. Everything from hosting informational conference calls with decision makers to workflow planning. We do training for both healthcare staff as well as community health workers. And we also provide continued maintenance support after integration. So even after things are integrated, we don't just say goodbye. We stick around and continually monitor. We offer all the technical support during the integration phase with the EMR. We do, depending on our funding, sometimes have pockets of money that we're able to provide for those that are integrating with the e-tobacco protocol with direct messaging, that they're able to receive some funds during the testing phase to help just offset any staff time or whatever it may be that may be holding them up. We can help with that. And then, like I mentioned, we can share that monthly report from the Quitline to the healthcare systems. And we have lots of print materials. I'll share some links for those at the end. So some of the challenges that we've seen or currently still see. So one of the big things is that there are so many unique healthcare systems. There are many different electronic medical records out there. So what we've been able to do to overcome that or better plan for that is we do have a team member with vast expertise in electronic medical records. So we're able to customize things for each healthcare system, including adjusting any of our training materials to meet their needs. In terms of workflows, it's really important for us to try to minimally impact the existing workflows. Systems can be a little bit hesitant to add any more questions than they're already asking. They have such limited time, they're so busy. But thankfully, most systems are already asking about tobacco use. So that's that ask piece. Most of them are also already advising and giving that brief intervention to quit. So it's really just connecting that final dot and making sure that they have a place to point those that are interested in quitting to somewhere that they can get that help that they need. And then in terms of staff capacity, staffing turnover is always an issue. We've been able to create several videos, varying lengths to be able to provide, training as needed for new staff. We also continually monitor our data and reach out to the healthcare systems to provide refresher training as well as needed. Data transmission methods. So earlier in this project, there are some transmission methods, and I'm not an IT person, so I'm not going to really get into the weeds of this, but there are issues sometimes with those older methods. You update your electronic medical record and it breaks things, or there's security issues if they're connecting through a VPN. So we are promoting a newer, though definitely not new, transmission method called direct trust messaging, which is just a secure message referral that is able to go through the electronic medical record directly from the healthcare system to the quit line, and it's just a secure way for them to be able to get that referral over. Data limitations. So we do get that aggregate quitline report. And UT does not receive any PHI, so this report is really the extent of our tracking. Unfortunately, with this newer vendor that the Quitline has, the report isn't able to distinguish between the different types of referrals, so we can't always tell between an electronic the e-tobacco protocol or a fax. So that can present some challenges, but we're working through that with them to try to get that figured out. And then just technology issues. Everyone I feel like has that these days, but the testing environment that the Quitline vendor uses to run their testing to help us prep as we get ready to integrate a new healthcare system has been having issues for almost a year. So thankfully, we were able to work out something and test in their live environment to get those healthcare systems moving through and being able to integrate. So where can y'all plug in? So if you have, I'm always looking for new healthcare systems, clinics, FQHCs, local public health department connections. So if you have any of those, I'd love to be connected with them. I do not have a connection with Del Med, so if anyone is connected with them, I would love to chat more about that. If you have any community health worker contacts, I kind of mentioned that we do training for them. I do have a, an approved course through DSHS that provides one CE. So I'd love to connect and offer that to them if you have any contacts. If you yourself or your team or you know of a group that would be good to be able to offer app referrals, such as, social service groups or whatnot, I would love to do some training and talk with y'all more about that. And then any other partnerships or research opportunities, or anything else that you can think of that we can connect with, I would love to chat more. So then just closing out, this is just some resources. I can send this out to the organizers and share this with y'all. It does include some of the resources that I was talking about earlier, including some of the free print materials that you can get from the DSHS website as well as our website. So with that, I will turn it back over. Thanks so much, y'all.
Thank you so much.
Any questions for Ashley?
I have a question, Ashley. Thanks so much for the presentation and just sharing information about it. But I was just curious if you ever partner with kind of systems other than healthcare systems, schools or community centers, places where, you might otherwise have access to to people for the system.
Yeah, so for the e-tobacco protocol, it's mostly any kind of, it doesn't have to be a healthcare system. It can be any entity that has an electronic medical record. So that's why we've kind of expanded to local public health departments. In terms of app utilization, definitely, anyone can do it. We do have some colleges that do it, so other unique places. So any entity that is connecting with the community to discuss resources, social service sort of things would be a great fit for learning how to use the app for referrals. It doesn't have to be a provider or health team member.
Right. So with the app, you don't have to have that electronic health record
Right.
service. So, okay.
Exactly.
Gotcha. All right. Thank you.
Mhm.
All right.
Very impressive work, Ashley. And that 200 times increase in referrals must have
Yeah.
been a clear sign of success. We do have some active members in the Public Health Coalition who are representatives of DelMed, so we'll make sure to put you in contact with them.
Thank you.
So our second presenter today is Dr. Erin Rodriguez. Dr. Rodriguez is an associate professor in the Department of Educational Psychology here at UT Austin. She is also the current area director for research at UT's Latino Research Institute. In partnership with schools, clinics, and community organizations, Dr. Rodriguez studies family, sociocultural, and contextual influences on children's development and health outcomes with a focus on understanding and reducing health disparities that impact Latinx youth. She also teaches courses in child social emotional assessment and pediatric psychology and health disparities in the College of Education. Please welcome Dr. Erin Rodriguez.
Hi, thank you, Jay. And is it okay for me to share my screen right now? Let me go ahead and do that.
Yes, please feel free.
Okay, great. All right. Well, thank you so much for having me here. I'm here to talk about the data services group of the Latino Research Institute, and just share with everyone here a little bit about the services that we offer through the data services group. For those of you not familiar with the Latino Research Institute, it is actually part of Latino Studies, which is comprised of 3 units in the College of Liberal Arts here at UT. So those 3 units are the Center for Mexican American Studies, the Department of Mexican American and Latino Studies, and finally the Latino Research Institute. And the Latino Research Institute, or as we call it, the LRI, was founded in 2016 by Deborah Parra Medina, who was the inaugural director and who is here at UT through 2024. She's currently at the University of Colorado. And there are 3 prongs to the work that we do at the Latino Research Institute. One being research, and that's where our data services group is housed. The second is academic, career, and leadership programs, and the third is community engagement. This is a bit more about our vision and mission at the Latino Research Institute. So we aim to become a national leader in advancing science and practice that promotes healthy, productive environments in Latino communities. And in terms of our mission, we are aiming to cultivate a community of engaged scholars who are producing interdisciplinary research that informs policy and actions to enhance the well-being of Latinos and their communities. And just a bit more about our strategic plan at the Latino Research Institute. Really, our goal is to produce high-impact interdisciplinary research, and we do this, in several ways. One is really designing research that addresses health disparities and promotes health equity. Second is really making sure we're employing research methodologies that are culturally responsive and take into account social and geographic contexts. We really work to create a network of researchers that are engaging with one another as a means of producing excellent scholarship. And we have a commitment to community collaboration involving co-creation, shared leadership in research, and really incorporating that community-based participatory research model. So then I will talk a little bit now about our data services group, which is part of the Latino Research Institute. The Data Services Group is a service offered through the LRI that provides a range of research support services across the research life cycle, from inception to completion of a research study or a program evaluation. And these services are for researchers at UT and other faculty affiliates, as well as community agencies. And through the services, the other thing that we work to do is to provide training opportunities to undergraduate students and graduate students, particularly in relation to data management, data analysis, and data collection. Here are three of our wonderful core team members of the Data Services Group. And two of them, I think, are here today as well. Minyu Zhang, Christina Galvan. Minyu is our database coordinator. Christina is our research associate with the Data Services Group. And then Peicheng Li is our graduate research assistant. And as I said, these are core team members, but we also have other people, everyone from senior undergraduate research assistants to graduate research assistants, postdoc, and other staff members that we kind of draw upon according to our every project's needs. This is a little bit about the history of the Data Services Group. So we came into an existence in 2017 and really were created in response to a need that was expressed by researchers at UT Austin in several listening sessions across campus. So the need that was expressed was support in conducting research with Latino populations. And that really informed the development of the services that we offer through the Data Services Group. So currently, we are serving 10 principal investigators. Those include UT researchers and other faculty affiliates. And what we have been working on this past year is really formalizing and expanding our services so that we can offer services for the entire UT research community. And I'll also just mention a couple of other initiatives that we have through the Data Services Group. One is our archive in Texas ScholarWorks, and that's an archive that's freely available to everyone at UT to document study protocols and other study materials that have been conducted and used in studies conducted through the Latino Research Institute. So that's one initiative. And then our second initiative is the Publication Support Initiative, and that is funding that's provided to early stage investigators to conduct secondary analyses with existing data sets that came out of projects that were administered through the Latino Research Institute. So here are some of the services that we have available through the Data Services Group. And again, they are all specifically tailored to working with Latino populations. So that's really our aim, that we're providing this service to the UT community, really specific to the work with Latino populations. So in terms of research consultation, that can include things like, researchers might have questions about methodology or study design, really at the inception of a research project, or perhaps, struggling in the middle of a research project and really wanting to get some consultation around how to make improvements. In terms of survey programming and testing, we can help with designing survey instruments and piloting of those instruments with an eye towards cultural relevance and functioning within the Latino community. And we also set up data collection instruments like REDCap or Qualtrics survey tools so that that support is there as well. Another service that we offer is translation and transcreation of study materials. We really follow the translation process using the gold standard process, which involves, forward translation into Spanish, back translation, and sort of an iterative process until the two versions meet. And we also really consider this process of transcreation. So you may or may not be familiar with that term, but that really means does the construct validity of your assessment instrument really hold from English to Spanish and from population that it may have been originally validated with to Latino population and to the specific Latino population that you're working with? And so does your translated measure appropriately capture what you want it to with that specific population you are working with? We also offer, help with protocol development, a range of protocols, including for recruitment, consenting, and data collection. In terms of data collection, we can hire and train research assistants to collect data according to those protocols, and again, with specific training for community-based data collection. And all of our research assistants are bilingual and bicultural. In terms of processing and analysis for data, we also have expertise managing data sets, cleaning data, preparing them for analyses, and then finally, just expertise in a range of analytical approaches. And with dissemination, the members of the data services group can be involved in helping with the publication process and have co-authored several papers with our PIs, but also involved in disseminating information to community stakeholders and including Spanish-speaking stakeholders. And finally, we have data storage and archiving services that really help manage data sets for the long term, and again, provide them for secondary analyses. Our process that we've been finalizing this past year and formalizing this past year is through several steps. So typically we will have a PI express interest through an online inquiry form that leads to an initial intake meeting, which lasts about 30 minutes. And that allows the data services group to get to know more about the project and the specific services that might be relevant to the project, as well as for the PI to really get a really good idea of what the data services group can provide. And if there's a good fit with the services that the data services group has to offer, the PI can share their proposal, and our data services group will create a service plan tailored to that proposal. And there's an opportunity to discuss that plan and have a longer meeting to really finalize the service plan in writing. And ultimately, the data services group drafts a written service plan and a cost estimate. And once both parties are in agreement about the final service plan and cost estimate, then we can kind of officially kick off our collaboration with that PI. So I want to talk a little bit about just one kind of case example, a recent study that was supported by the data services group. So this is the study of a Commission on Women and Girls Quality of Life study. And the PIs are not in COLA. They are actually from Adele Medical School. So Carmen Valdez was formerly the PI, and currently Jessica Calderon Mora is the PI. And this was funded last year by the City of Austin, the Quality of Life Commission. And the aims of this study are really to understand kind of the experiences and demographics of the population of women and girls in the City of Austin and in Travis County. And by doing so, understand better the needs and the community factors that are impacting quality of life for women and girls in Austin. And then report that current state of those needs and community factors for different demographic and geographic groups, and which of those factors are really impacting quality of life for women and girls. So, of course, there's a large population of Latino women and girls in Austin and Travis County that will be enrolled in the study. So the data services group was a good fit for providing services around this project. And the way this kind of collaboration played out is that the PI, so Carmen Valdez, contacted the Latino Research Institute for data management support, and our data services group actually provided two options. One in which the data services group would hire an entire data management team and supervise that team and be involved in data collection. And then the second proposal was one in which the data services group would only provide data management. And the PI selected the second option to just get some support in setting up the survey and the data collection tool through REDCap and managing that data within REDCap. As I had mentioned, we have our core team, but we also pull in other staff support from across campus. So we involved a postdoctoral fellow from the Steve Hicks School of Social Work to support the process with Minu, our database coordinator, supervising him. And the project's currently in the data collection phase, so it's ongoing. And I know they're doing excellent work on that. As I mentioned, this year has really been a year to formalize and ramp up our services to serve the entire UT community. So this past fall, we developed and refined our online inquiry form and updated our website. And we piloted our intake process with a couple of PIs just to kind of get a sense of, what is working, what do we maybe need to be clearer about, and what is the best way to go about these collaborations. And we got some good feedback and information from those PIs. And then this spring, we've been continuing to pilot with a couple of additional PIs. We're making some final refinements to the website. And our goal is to really, spread the word, introduce these services to UT researchers, which is why I'm here today. And finally, just, open our intake process to the UT community by June. Again, our data services group is this core team of individuals, but we again bring in postdocs, GREs, and undergraduates. And then this is also our leadership team. Again, I'm happy to answer any questions, and our staff are very accessible to answer any questions or inquiries. I thank everyone for their time and sharing what we have to offer.
Thank you so much.
Thanks so much for that, Aaron. As a Hispanic serving institution, I feel like this is something we need to definitely highlight more here at UT.
Yeah,
Uh,
cool.
any any questions for Aaron?
Hi, Erin. I have a question. Have you all connected with and sorry, I work at the Center for Health Communication. And one of the projects we work on here at UT is the Whole Community's Whole Health Initiative, which is kind of like one of the grand challenges that UT has set out. And they do a lot of work in kind of the Eastern Crescent of Travis County. And I'm just curious if you all have touched base with them yet, because I can see a really good, pathway to a partnership on that.
Yeah, no, that's a great point. And we did kind of communicate with Whole Communities Whole Health and the Office of the Vice President for Research when they had they had a networking event in the fall for any unit on campus that is providing kind of research support services. So we had one of our leadership team members attend that and network with them. But I think you're right. Absolutely. I know that cohort that they've been working with is predominantly Latino, and a lot of the same issues are coming up in their research. So that would definitely be a good connection. And I think Minu, you're here. If you have any other information about efforts or collaborations that have happened in the past with them.
No, but that's definitely a direction that we can work towards this year.
Yeah, that's a really great point. Thanks, Catherine.
Any other questions for Aaron? Nice. Thank you all for joining us today. We will be continuing this throughout the semester, so be on the lookout for those invites to future seminars. Kyle?
Thanks so much, guys. I hope you guys all have a great day, and I'll be posting this on our website and on our YouTube in a couple hours. Probably it'll take me that long to get it up, but it should be up at the end of the day. So you guys can feel free to share broadly once it's up. Thanks so much, guys.
Thank you.
Thank you.
Thank you.
Thank you.
Bye.
Take care.